Hello, my name is Lori Stonecipher. I work at Community Health Network in Indianapolis, Indiana. And today I want to tell you a little bit about my career journey. Let's start with today. Currently, I'm our Vice President of Clinical Informatics at Community Health Network. Our team helps bridge the gap for the frontline clinicians. So our frontline physicians, nurses, and frontline caregivers, we make sure that they know how to use the technology in their everyday work. One example of that is the electronic medical record system, where they do all of their clinical documentation. We make sure that those providers and nurses have the best documentation tools to make them very efficient so they can care for their patients. Now, I've been at Community Health Network for about 19 years, but let me go back in time and tell you a little bit more about my journey. I went to school at Indiana University in Bloomington. Go Hoosiers. And I actually first started out there and I wanted to be a nurse. I had a family friend growing up and she was a nurse and just really admired her and thought that's what I wanted to do. However, I can't really handle the sight of blood, so quickly decided to change my major while at Indiana University. I switched from nursing to business. So I actually went through the Kelley School of Business at IU and got a business degree with a concentration in computer information systems. I've always loved technology and was excited about what that career opportunity and where that could take me in my career. Although I had a passion for healthcare, it's ironic that I landed at Community Health Network. One of my first pieces of advice for you is that just because you think you want to go into one profession and for maybe whatever reason that doesn't work out, consider other opportunities in that same industry. So for me, nursing was not in the cards for me, but I still ended up at a healthcare organization focusing on technology that ultimately still impacts the caregivers and the patients in a positive way. So after school at Indiana University, I graduated and I did start at Community Health Network. Back then I started out in the IT department and I helped answer the phone calls for the physicians and caregivers who needed help with their computer, their printer, etc. I did that for a couple of years and actually very much enjoyed that work. However, I didn't feel like I was using my business degree. I'd gone to college, spent all this hard work and time getting that business degree and really wanted the opportunity to use more of what I learned. So an opportunity presented itself where I could go manage a physician office. So I actually managed an allergy and asthma office in Fishers, Indiana. And I did that for 4.5 years. I loved it. It gave me great opportunities. My first time managing a staff, really got to understand what it was like to run a business in collaboration with the physician lead there, and just all around a great opportunity to truly use those business school skills that I had learned. During that time, I decided to go ahead and get my master's. So I went back to school at Indiana Wesleyan University and I got my master's in business administration. So my MBA degree, and this time I decided to do a concentration in healthcare since that's where I was working. So during that time, got my degree, managed the physician office, absolutely loved it, but I really missed the technology. So when another opportunity came back, I went back to the IT department for Community Health Network, where I had the opportunity to roll out our electronic medical record system for all of our ambulatory offices. So primary care offices, specialty offices like cardiology or infectious disease, etc. And so really love that opportunity. Spent about 6 years on that team where I led our team who rolled out our computer system to all of those offices and really enjoyed being back in the part of technology. So I did that until about 5 years ago, there was an opportunity to lead our clinical informatics department. And as much as I loved the job I had before that, where I was rolling out the technology, I was looking for a change of pace. I really wanted to work with the frontline caregivers again and to see what we could do to make their jobs easier and more efficient. And so that's what I do in my job today. As I mentioned at the beginning of the video, we are the bridge between the technology and those frontline caregivers, so really gives me that opportunity to help make their day better so they can focus on their patient. So that's a little bit about my journey with Community Health Network and where I went to school and how that all comes together. I do have a couple tips of advice for you as you embark on your journey of getting higher education and considering what career paths are for you. My first piece of advice is work hard. Work hard and work hard all the time. People see who work really, really hard and it gets you really far in life. So that's my first piece of advice. My second is understand what your core values are. Think about what's most important to you and what you're going to portray in your work environment. So for me, my highest is integrity. I'm all about being honest and trustworthy at all times, as well as holding people accountable and making sure there's a fair process for everyone. And my colleagues around me know that integrity is one of my highest core values. So know what your values are and make sure that you portray those in the work that you do, because when it gets tough, you got to always lean back on those core values. And then the last piece of advice I would give you is relationships are key. Don't ever burn a bridge. It's really important to just really get to know people and to build a relationship with those that you work with, not only on your team, but your peers across the organization, but people in the community. Just really have a big, strong network around you and invest the time in those relationships, because you never know where they will get you in the future. Thanks for listening to my video. I wish you the best of luck.